Did you ever wonder if a gadget could be the same as a pill when it comes to anxiety? In this video, I'm going to take a clear and practical look at whether anxiety devices are able to realistically match the effects of medication. I'm going to cover 3 broad device categories. I'm going to explain how each one works, what the science currently says, who might benefit, and most importantly, what realistic expectations are if you are thinking about using one instead of or alongside medication. First, a quick roadmap. We're going to look at transcutaneous vagus nerve stimulation, which you will hear called tVNS. We're going to look at wearables that monitor physiological signs and sometimes deliver prompts. And we are going to look at biofeedback, which is a type of training that teaches you to change body signals like heart rate variability. For each of these, I'm going to compare the mechanisms to how common medications work so you can see where there is overlap and where there are fundamental differences. Let us start with medication briefly so we have a baseline. Common anxiety medications are selective serotonin reuptake inhibitors, known as SSRIs, and benzodiazepines. SSRIs change brain chemistry gradually and can reduce baseline anxiety over weeks to months. Benzodiazepines change brain signaling quickly and can reduce intense panic or acute anxiety within minutes, but they carry dependence risk with long-term use. Medication is acting on brain circuits in a widespread way and often produces large and reliable changes in symptoms for many people, especially when anxiety is moderate or severe. That is important to keep in mind when we compare devices. Now let's look at tVNS. This is a method that stimulates the vagus nerve through the skin, usually at the ear or the neck. The idea is that by activating the vagus nerve, you are engaging a pathway that links the body and the brain. That pathway is already known to influence heart rate, inflammation, and stress responses. There are some clinical trials that show tVNS can reduce anxiety and depressive symptoms in some groups. The effects are promising in early studies and in small samples. However, the trials are varied in quality and size. That means the evidence is not yet as consistent or as large scale as most medications have. In practical terms, tVNS is a tool that is able to modulate the same symptoms that some medications target, but it is not yet established to reliably replace medication for people with moderate to severe anxiety. For someone with mild symptoms or someone who is already stable on a medication and wants to trial a dose reduction under medical supervision, tVNS is reasonably thought of as a possible adjunct. It is not a guaranteed substitute. Next, wearables. When people say wearables, they usually mean smartwatches or wristbands that measure heart rate, skin conductance, sleep, and movement. Some wearables only monitor. Others add coaching prompts or guided breathing when they detect elevated stress. Wearables are very good at giving you information. They are often excellent at showing trends in sleep and activity and at detecting short-term increases in heart rate. That information can be useful because it makes stress tangible and actionable. For example, seeing that your heart rate rises at the same time each evening can help you identify triggers and change behavior. A second category of wearables tries to be active. They will vibrate and ask you to breathe or will guide you through a brief exercise. Those interventions are useful for momentary downregulation and for building awareness. The limitation is that wearables generally do not change underlying brain chemistry in the broad way that an SSRI does. They are tools for detection and for brief regulation. For mild anxiety or for people who are learning skills, wearables can be very helpful. For severe anxiety, they are rarely sufficient on their own. Third, biofeedback. Biofeedback is a formal training method where you get live signals about your physiology, usually heart rate variability or breathing, and you learn to change those signals through practice. There is robust evidence that biofeedback can increase heart rate variability and reduce symptoms of anxiety and panic. The mechanism is training self-regulation so that your nervous system becomes better at returning to a calm baseline. Biofeedback is skill-based. That means it takes practice, and with continued use, benefits can accumulate. Evidence shows medium-sized effects in many studies. In contrast to wearables, biofeedback is often delivered in structured sessions with a clinician or therapist, and that makes the results more predictable. Still, biofeedback is not a molecular intervention in the way an SSRI or a benzodiazepine is. It does not change neurotransmitter levels directly. For that reason, biofeedback is very well placed as a complementary therapy, and for many people it reduces symptoms enough that medication requirements are lower. For others with long-standing or severe anxiety, biofeedback alone will not match medication effects. Let us pull these comparisons together so the picture is clear. Devices are generally oriented around 3 roles. 1, they can detect and monitor. 2, they can help with short-term regulation and teach skills. 3, some of them attempt to directly change nervous system signaling. Medication is usually systemic, meaning it changes brain chemistry in a way that is broad and sustained. That difference is exactly why devices and medication are often best viewed as complementary rather than strictly interchangeable. Now, I want to be concrete about who might expect what. If someone has mild anxiety, devices are often an excellent first step. A wearable that improves sleep and increases activity combined with few biofeedback sessions can produce meaningful symptom reduction. If someone has more moderate anxiety that is interfering with work or relationships, combining medication with devices is a reasonable and evidence-based path. Devices can speed skill learning, reduce side effects by allowing lower medication doses, and give people tools for acute episodes. If someone has severe anxiety or complex conditions like panic disorder with frequent panic attacks, medication is often the first-line treatment because of its larger and more predictable effect size. Devices can still help in those cases as adjuncts, but they are unlikely to fully replace medication quickly. Let us be honest about limitations. First, the research quality is mixed. Some device studies are small, some lack good comparison groups, and some are funded by companies with a business interest. That is not proof of harm, but it is reason to be cautious. Second, placebo effects are powerful in anxiety research. The expectation that a device will work is part of why people improve. Placebo effects are real and clinically useful, but they are different from a direct mechanistic replacement of medication. Third, access and cost matter. Some devices require purchase, subscriptions, or clinic visits. Insurance coverage is not always available. Fourth, safety and regulation are variable. Some devices are cleared by regulators for certain uses. Others are marketed as wellness tools with less oversight. That means you should check the evidence and the approvals before you invest. Here are practical steps if you're watching this and considering devices. 1, talk to a clinician before stopping or changing medication. That sentence is very important. Do not stop medication on your own. 2, if you want to try a device, start by defining a goal. Is your goal to reduce panic attacks? Is your goal to sleep better? That focus guides which device is likely to help. 3, use devices as part of a structured plan. For example, pair biofeedback with therapy or pair tVNS with medication under supervision. 4, measure outcomes. Keep a simple symptom diary for 4 to 8 weeks so you are able to see whether the device is helping. 5, be prepared to combine approaches. Most effective anxiety care uses more than one tool. Finally, what is the short answer to our question? Can devices realistically match medication effects? For many people with mild anxiety and for people who are motivated to learn self-regulation, devices are able to produce substantial benefit and in some cases, reduce or replace medication under a clinician's guidance. For people with moderate to severe anxiety, devices are unlikely to reliably match the effect size and the speed of onset of common medications on their own. Devices are best thought of as powerful complements. They improve skills, provide real-time regulation, and in some cases, reduce the need for medication. They are rarely a guaranteed replacement for medication, especially where symptoms are severe or long-standing. If you're curious and want a next step, speak with a mental health professional and consider a trial period where you measure symptoms consistently. If you are already taking medication and you want to integrate devices, ask your clinician whether a combined approach is appropriate. If you are shopping for devices, look for independent studies. Look for regulator clearance when available, and be wary of claims that sound too absolute. If you found this useful, please give us a like. It helps this content reach more people who are trying to make sense of anxiety treatments. If you want more clear breakdowns like this, please subscribe. Thanks for watching, and take good care of yourself.